Hello, everyone, and welcome to one more episode of MetaCast, the podcast of the Meta-Analysis Academy. Today, I have a special guest here with me, Dr. Atul Taneja. He is a musculoskeletal radiologist currently at University of Texas Southwestern with an incredible career as an international medical graduate and a radiologist with established career in clinical care and education, and then he transitioned into the United States for an extraordinary career here as well. So we're going to learn a lot from him. You're going to be inspired. And if you're a radiologist or a specialist in your country, whether it's Brazil, where we're from, or elsewhere in the world, it's going to be really transformative experience for you to learn about. So, Dr. Taneja, Atul, thank you so much for joining.
Thank you so much, Anderson. It's my pleasure to be here, and congrats on your hard work, and you're a great inspiration for all of us.
Thank you, sir. You know, we've known each other for a few months now from social media, exchanging messages, so I'm really glad to finally meet you here.
Indeed, same here.
All right, so before I start and ask Atul some important questions, just a reminder, what we discuss here today is not affiliated with the institutions where we work. The opinions are exclusively our own. Also, want to invite you to subscribe to the channel and tune in to the Meta-Analysis Academy other episodes on MetaCast. Also, if you want to learn how to do impactful research with autonomy, join our waitlist for the Meta-Analysis Academy, where you can learn how to build impactful research through systematic reviews and meta-analysis. So, Atul, let's start a little bit about your background. Where are you from originally, and a little bit about your training in the earlier years of the career, like medical school and then residency.
Sure. So my history starts in Florianópolis, Santa Catarina. I'm from South Brazil, and I did my med school there. And then after finishing med school, I went to São Paulo, the big city. I wanted to know the big São Paulo, what it brings. And then I went for residency at Unicamp in Campinas, São Paulo. And then I stayed in São Paulo State for my clinical fellowships.
Nice.
I'm dual certified both in neuroradiology and also MSK radiology. And then after fellowship, I wanted to pursue a career in MSK, so I dedicated for musculoskeletal radiology since then. And then I had some of my training in São Paulo in the heart hospital as MSK radiologist. And then I underwent a research fellowship at Mass General Harvard,
Nice.
which was very, very enlightening for my career.
So let's talk about that decision to come to the United States. But first, I just want to give people perspective. The places where Atul mentioned are some of the best places in Brazil. Both to live, like he's from Florianópolis, that's one of the best cities in Brazil. It's in the southern part of Brazil. If you guys Google it, you see beautiful beaches. It's a really incredible place, one of the best places in Brazil. And then he went for the best institutions in terms of residency, Campinas, São Paulo Heart Hospital. So these are some of the most fantastic places there. And obviously, had incredible training, and with that, a lot of opportunities. I'm sure you could have gone back to your home city, you could have stayed in São Paulo, and then you decided, it seems like after residency and fellowship, it seems like you decided to come here for a research fellowship.
Exactly.
Why was that?
So interesting thing is that I wanted to explore a little bit more about research. I didn't get too much of I didn't get in touch with research too much during medical school or residency, and I wanted to feel it. I wanted to learn more about it. I wanted how to publish, and then I said, let me go further on my musculoskeletal radiology training, and then I'll try to go to U.S. And then at that time, the São Paulo Radiological Society (SPR) had a selection process. Harvard and SPR. I said, well, that seems very interesting. Maybe I'll try that. And then I was very happy to be one of the selected for that fellowship. That was back in 2012.
Okay.
And that's when I came to U.S., and the plan was 1 year of research fellowship.
So that was at Massachusetts General Hospital?
Exactly,
Great. And which area? Was it in MSK?
MSK Radiology at the MSK Radiology Division.
Okay. A lot of the listeners may not be radiologists, so obviously MSK means musculoskeletal, for those of you who are not familiar. And it's one of the most competitive areas in radiology, at least here in the U.S., because I work with the radiology residents as they go through their cardiovascular training. Everyone wants to do MSK.
Yeah. MSK, it's interesting, specialty because it's very broad. You can work with tumors, you can work with infections, you can work with sports imaging, which is something I love. You can work with spine imaging, so it opens a wide range of possibilities. I think that's why MSK is so exciting.
So what you guys are going to listen in this podcast is really a masterpiece in building an extraordinary career and building academic authority and being really great in your clinical care job, like as a radiologist, but also doing research. And one of these, and as an educator too, but one of the critical decisions, at least in my opinion, was the decision to focus on research as opposed to just doing a fantastic job as a MSK or a radiologist. And when people are faced with that decision after residency and fellowship, there's a big financial incentive to go and work. I mean, right? And it's sort of like delayed gratification at its most extreme form, because you already do that in med school and then residency and fellowship, and it just takes so long for you to finish training and go get a job. But when you could go and work as a radiologist, you decided to invest in your career.
Perfect. Yeah, that's interesting because during med school, I remember that in the middle of the mid school, in the mid of the med school, I wanted to do research, and then I went lab to lab, knocked at the doors of the lab directors. Hey, I want a position as to do some science, to do some research, and I didn't get it. I spent a few months trying. I was kind of in the middle of the season that all the positions were filled, and then through med school, I didn't do any research, any publication. And then during residency, by the last year of residency, I was able to publish 1 or 2 case reports. And then after residency, fellowships, and starting a career, starting to work, and after so many years, starting to receive some salary. And after that, I said, you know what, I want to explore a little bit more, but let me give me some more years. I can have a financial I'll be financially stable, so I can go outside. Because usually when you come from outside to U.S. and you want to do either an observer fellowship or a research fellowship, not always you're going to be funded, right?
Right.
So,
especially if it's research.
Yeah,
right?
exactly.
When you're doing a clinical fellowship, generally, yes, but a research fellowship, no.
Exactly. So when I came to U.S. was after 3 years I finished the residency. So I was able to handle the financial part of it. And
was it a paid position here?
No, it was non-funded.
Wow.
It was a non-paid position. But gladly, after 2-3 months, we applied for a grant. I recall pretty well. It was a grant on MRI of chondral tumors using non-conventional imaging, and we were awarded with an internal grant. Then I started to receive some salary through my research fellowship.
That's awesome.
Yeah.
And you stayed for 1 year?
Yeah, 1 year exactly.
How was that year? Like, were you productive? Did you make the connections, of course? And did you enjoy the experience?
Yeah, it was an amazing year. I was very well received, and I still feel them as like a family, like an MSK family. Throughout these 12 months, I was able to publish, to learn how to write a paper, to learn how to do some stats, to write the results, and to bring everything to an article. And in this entire year, I was able to publish 10 papers with my mentor.
Wow, that's incredible.
And by the end, they were nicknaming me Atul the Machine Taneja. It was very affectionate name, and everyone was very happy. It was a great time. And from there, research brought me so much,
Yeah.
In Brazil, we know there is not too much of incentive to research, but I always try to use my learning research within my work, my clinical work. So during the next years, after going back to Brazil, I worked also not only in the heart hospital, but Albert Einstein Hospital, one of the top 20 hospitals in the world currently. And over the years, I was able to build like a research team, and we published a lot. We still publish,
Wow.
And that came from learning how to publish, learning how to collect data, learning how to analyze, and to not only publish but teach others how to do that. So it was my year here was a great experience to spread the importance of MSK radiology research.
Yeah, and it sounds like you really shaped the next years of your career.
Indeed,
Yeah.
exactly.
Yeah, and again, you went to Einstein, you said?
Yes.
One of the best hospitals, again, in Brazil. And give us a sense of how was your career there in Brazil over the upcoming years. You mentioned that you were already very active in doing research. You established a research culture around you, which is really phenomenal. What about in terms of clinical work? You were practicing MSK radiology, where the volume's really high. What were those years like in your career?
Yeah, so those years were mainly clinical. So I would say 89% of the time of my effort time on the clinical, reading studies on joints, spines, and all sort of extremity imaging, and then I had few hours per week for research. We were doing on the side something related to research, sending projects and presentations to big meetings like RSNA and Brazilian meetings. And then throughout the years, we were able to build this research team. And I think when we speak about research, it's something that challenges you every day. You want to produce something new. You want to bring something new to the science. And then if you can use your clinical work as a motivation to bring new ideas and bring new concepts in research, that's the best of two worlds. So I'm very happy I was able to do that. And let me tell you an interesting story here, Randerson. In the beginning of my career, residency in early years, I heard... hey, you know what, Atul? I heard from older folks, research not gonna get you anywhere. Research not gonna make you rich. But I didn't care about that. I said, I want to do something different. I want to build something. I want to think ahead. And now research gave me most of what I have. A position in USA, a very good visa, position as someone as an expert in both now in Brazil and outside. So don't let these bad ideas or bad concepts don't let these ideas let you down. Just move forward, and research can bring you lots, not only towards patient care, but also towards yourself.
What you've just described, the incredible career that you've had, is similar to mine in the sense that you and I are predominantly clinical.
Yeah.
Let me just give people an overview. In the United States, there are people who do a lot of research. They're like 80% of the time they're doing research. They're applying for grants and they fund their salaries doing research. So there are people in the U.S., other places in the world too, but the U.S. has a strong culture in this sense. There are people doctors, MDs, who are doing a lot of research. Where we're from, it's not common that people spend a lot of their time doing research. The people who do research do it on the side. They do it because they're motivated. They do it because they want to build their career and move forward. And I did that same in the United States, the same thing. I was a resident, a fellow, always publishing and building a strong research output to grow and advance my career. Even now as a cardiologist, I'm a clinical cardiologist. I work 80 to 90% of the time seeing patients, reading studies, a lot of imaging too. But, we still do research because, one, we like it. Two, we realize how important it is to the field.
Yep.
Three, it helps our careers. Whether people do that as a primary intention or as a secondary intention, it's what I've been saying for 3 years with the Meta-Analysis Academy. It's like research advances people's careers.
Yeah, in all the aspects, not only in your CV, but you're building something new for your patients, for your group, for your division, and you're producing science. I think as we increase the awareness of doing research, we'll be better clinicians.
Yeah, we've talked about research. We've talked about all the clinical training you've had, being a radiologist.
Yes.
But you're also an educator. You're also renowned for your courses, your teaching skills. Yeah. Tell us a little bit about what you did in Brazil, and then later on we'll get into the alternative pathway, how you help people with that.
Yeah, that's very interesting. So throughout my almost 15 years of my radiology career in Brazil, I always enjoyed lecturing and speaking on big meetings, both in Brazil and outside. I'm part of great musculoskeletal radiology societies, such as the International Skeletal Society, which has a very rigid and selective process. I was able to be one of the first 10 members from Brazil, and then not only teaching in the meetings, but in the med school, also bringing courses on MRI of the wrist, MRI for orthopedic surgeons, MRI of MSK in general. So I always been very close to teaching. And then after many years teaching MRI on MSK radiology, when I came to US, I was mainly focused on my work here, but interesting thing is that I got so many messages and people contacting me, hey Atul, how did you get to US? You had a very well-established career in Brazil, working in the best hospitals, and what did motivated you, and how did you get there? I want to go to US. I want to work in US. So then I took all these questions, these ideas, and then beginning of this year, I created this workshop that I call From Zero to America, the alternate pathway for radiologists. The alternate pathway is something that's very clear from the American Board of Radiology, but it's not well known, and there is a clear path to that. So I put everything into a course, and people are very happy about having someone that has been through all these steps and teaching how to do it, since there is this option to come to US. And the alternate pathway, if you go through the alternate pathway, you don't need to go over the match residency selection process. You, as a radiologist from an outside country, you can come to US directly as a fellow or attending. Yeah. So that was the big step, interesting this year.
Yeah, and I've heard incredible things about your training and your guidance of your trainees, let's say, on your course or your teaching about the alternative pathway. So educate us. Tell us a little bit about it. Let's start with the question you posed. What motivated you to come back to the U.S. after having this really well-established career in Brazil?
Sure. Great question. So after 1 year, I did have the opportunity to stay here at Harvard, but I wanted to build my career in Brazil. I had my mentors there, my family there. But over the years, after almost 15 years, I think it was more a personal and family decision. Me and my wife, we decided, maybe we should try to go to U.S. Looking for the American dream, which means quality of life, safety, great institutions, and great education. So we came because we wanted to do a big move, and it's really big. And I tell all my colleagues and students that when you decide to come to US, it's not about profession only. It's a big movement on your life. But you need to be very certain of your CV, of your profession, the position you're going to get. You're not going to change something you have well established for something you are not sure. So make it happen in a certain way that you know what you're going to get. And what was the other question?
Well, the other point I wanted to address.
The alternative.
Yeah, go ahead. Yeah, the alternative pathway. It's just that it's an incredible route for radiology. I was telling you this earlier that people from other specialties they get jealous. It's such an incredible opportunity.
Yeah, as a radiologist, we are very lucky to have the alternate pathway from the American Board of Radiology. The American Board of Radiology is the institution that will take care of your certification. All right, so the alternate pathway exists for many years, but it was not very well known. So every year, this awareness has been increasing. And how does it work? One radiologist that is trained in overseas and is certified as a radiologist overseas, he can come to U.S. Without going through the match residency program. So which are the options? You need to fulfill 4 years. These 4 years of new training can be done as a clinical fellow or as an attending, and you can use up to 12 months of research.
Out of the 4 years.
Everybody gonna ask, how many years of fellow? Can I go as attending directly? So here it goes. You can do a mix and match. You can do a mix of fellowship and attending position, but it needs to be a ACGME accredited Department of Radiology. All right. As also we know, the radiology market is very hot, meaning there is a increasing need of radiologists in U.S.
Yeah.
That makes the need to bring people from outside. So every year, the alternate pathway has been more flexible. These 4 years I just mentioned, it can be done within 8 years span. It doesn't need to be consecutive. That's one interesting thing. In 2022, they dropped. They took out the obligation of nuclear medicine rotation. So you're gonna do only radiology. That's another interesting thing. And this year, some rules also came that made even more flexible. The first one is the fact that years before, these 4 years of training needed to be done in the same institution. They switched for, you can use 2 different institutions.
Awesome.
That gives a lot of flexibility if someone needs to move, either due to adjustment on the city or a better opportunity of job offer.
Or just, like you said, technically it was possible for people to do 2 or 3 years and then not find a position for the next year
happens. Yeah.
and then have the door shut. But now they can go somewhere else.
Yeah, exactly. That happened before, or someone didn't get the 4th year or needed to go back to your own country in the 2nd or 3rd year. Now, you can use the years you have, even if you need to give a bigger gap. And another rule that came this year that shows how the job market needs is that if you have a part-time position, 2 years of part-time position accounts as 1 full year as alternate pathway.
Wow.
So this shows how much the USA wants foreigners here, well-trained, with radiology training from outside without needing to go over the residency again.
Yeah, it's so true. I was talking to a cardiac surgeon yesterday from Brazil, and he's really experienced, probably has 15 years of a career already. And I know some other cardiac surgeons who've come from outside to the U.S. too. And the key principle I shared with him and I share with the audience is that for these specialties like radiology and the surgical specialties, that the training is long. It takes such a long time for you to get an MSK radiologist like Atul, and especially someone with the experience that he has. So the programs like University of Texas Southwestern, like Hopkins, Harvard even, they're always looking for good people, not just in radiologists. I'm a cardiologist, so I work closely with cardiac surgeons. Every institution I've been is always looking for a cardiac surgeon. So people are really well trained from other countries around the world. There are these opportunities. Radiology makes it really easier, not necessarily that it's easier, but it has a very clear and well-established way how to do it. But in principle, in general, hospitals, institutions have a really high demand for well-trained specialists, especially in radiology and surgical specialties too.
Indeed. So one thing to keep in mind, you still need to go, you still need to do the USMLE steps.
Sure. Yeah, good point.
That's one point. There are some exceptions, but I would not count that as a rule. And secondly, you need to have a good CV. You need to have established either certification, meaning radiology certification, or radiology residency, or even better, people usually ask me, do I need to have lots of publications to be considered to a fellow? No, you don't need to have the best CV, but you need to show you are better than the other applicants. So then that's where research comes.
Yeah.
Publications and building a strong CV will help you. And then it comes this thing, how, especially old graduates like me, they want to move and they want to come to US. Atul, how can I go to US as an attending like you did?
Yeah, I was going to say that.
Yeah.
Because I don't mean to cut you off,
Sure.
but I've interviewed people about the alternative pathway, and I've met a lot of people, but they've come as fellows. Sometimes even repeating some training that they already had. Let's say they're a vascular radiologist, they do vascular training again. But I don't know many people who come as an attending like you, Atul. So what's the secret?
Yeah, so the secret is build a network. That's first thing. Be part of societies. Do observer fellowships. If you can, research fellowship. Publish. Build a CV.
Yeah.
Show you have something different. That will help you. And I think meta-analysis comes along with that. That's a way of doing independent research, independent publications. And if you show you are better or different than others, you might be considered for as an attending position.
Yeah.
That was my case. I started with hearing that research won't take you anywhere, and now I have 15 articles published.
How many?
50.
50?
Yeah, 50.
Wow, that's incredible.
Sorry, I said 15. 50, and I have a PhD. Although I heard many times this won't take you anywhere, not only gave me a position, that also gave me a very good visa.
Yeah, let's talk about the immigration part of it as well. And I'll just kick off the discussion on immigration by saying that when people come as fellows as part of that alternative pathway, a lot of times the institution will just sponsor regular visas for training. Like we've talked about here in MetaCast before with other guests, we've talked about the J visa, about the H visa. So if you're a radiologist in India or in Brazil and you're coming in, you're going to start your 4-year alternative pathway by training, a lot of times if you get picked for that position, if you get selected, if you get chosen, the institutions will help you with like J visas, H visas. But there's also the opportunity that people can take care of the immigration on their own by doing self-petitions for green cards using EB1 or EB2 NIW. Can you talk a little bit about that and add your personal experience?
Sure, that's a very important topic to discuss. When you plan a transition to USA, you should plan not only for yourself, but for your family as well. So this means the visa discussion. Like you said, most of the institutions will offer a J visa, or some of them will offer you an H visa. But then, remember, for those maybe who never heard of, we have also the possibility of EB visa, employment-based, although you don't need an employment, that's how they call it, EB1 and EB2 and NYW. So what is the difference between J and H visa? Is something you can do independently from your own country. That's what I did. I was very fortunate that my strong CV helped me for a EB1 petition.
That's
and
incredible.
I was approved. That means when you step in USA, you're going to be a green card holder.
EB1 is the genius visa, by the way, guys. It's like the superstar Nobel winners type of visa, and it's a common pathway that doctors use to come to the U.S., usually on the basis of academic authority and having degrees, of course, but like a PhD helps, but especially publications, citations, that really helps to prove your relevance to the field.
Exactly. Then that's besides the Olympic medalists, the celebrities, like you mentioned, Nobel Prizes, there are also the scientists. That's where we fit.
Yeah.
So if you publish, you have a good amount of citations, you can fit on the EB1 visa. So that's the big step. If you don't fit as an EB1 visa, you definitely, as a physician, as a radiologist, you'll be able to fit as EB2 NYW visa, which means you are qualified enough to show to the USCIS that you have enough qualification that you can bring something good to the country.
You can bring value.
And you can do it independently meaning you can get to, for you and for your family, a green card as soon as you come to U.S.
Yeah, so just to make it very clear again, very important, you guys, you can do this from your own country. Of course, you'd have to talk to an immigration lawyer
Definitely.
and make sure that you speak with someone who's going to give you good advice and help you to figure out if your application is going to be good enough. Of course, if you apply without a CV, without publications, there is a chance you could get your application rejected. But in the case of Atul, he had multiple publications. He was an MSK radiologist, had his experience in the U.S. I'm sure he had excellent letters of recommendations, and this builds a really strong case. You can apply it sounds like you applied from Brazil.
Yes.
You got this approved while I was still there. Then it opens more doors for you here. Because then the hospital, you have to see it from the hospital's perspective, from your employer's perspective. Now you have someone who's incredibly well-trained, lots of experience, and they don't have to deal with, J visa and H visa and O visa. So it's much better for them.
Yeah, it's a state of mind completely different.
Yeah.
You can, so the sooner you get in touch with publications, the better for you.
Yeah, for sure. Very good, my friend. That's an incredible career. And what you mentioned how hot the market is right now for radiologists. Can you just give us a little bit more insights on that? I'm not sure if actually, I could ask you just in terms of in general, how much would a general radiologist make in the U.S. after they finish the training? And people are always interested in the salaries and how it compares to their own countries.
Sure. Today was just released from Doximity, the payments, the average payments for physicians in USA. And radiologists have an average of annual payment about between 500K and 600K. All right, so we need to break this down into. One is the academic practice, and another one is the private practice. Academic institutions, you're going to be able to do research, education. Also, you're going to have protected time to do that. While you're doing less clinical work, this means you're going to have a little bit lesser salary. So academic institutions in U.S. will pay in a range of 400, 500 K per year, while private practice can bring you up to 600, 700, 800, depending if you become a partner. There are also the partnership track, and then you can get a bigger salary. But then remember, you might not get academic time. It means you have to work harder, because that's the private practice perspective. But it's a good range. When you compare to other specialties, radiology is definitely one of the top 5, top 10 specialties.
Yeah, it's a fantastic specialty. Before you guys divide that number by 12 and think that you're going to get there per month, don't forget that there's taxes, okay?
Yeah, that's
37%,
the raw numbers.
37% roughly at that range, and then plus usually state tax, okay? But in Texas, there's no state tax,
exactly.
and in Florida, there's no state tax, so that helps. Very good.
Yeah, that helps a lot.
Excellent. And of course, that's a lot of money, as you guys can imagine. It's it's more than enough to have a middle class, great quality of life in the States. Take care of your family, send kids to school, and all of those things. So, obviously, that's one of the advantages of here being in the U.S. Very hot market, not just for radiology, by the way. Right now, as a cardiologist, you get tons of opportunities every week, and they're always trying to recruit you. So, yeah, if you guys are interested in coming to the U.S., definitely do it. Atul, did you study for the USMLEs after you were already a radiologist then?
Yeah. So
go ahead.
Yeah, when I decided to come to U.S., I didn't have any of the steps exams done. So I was about more than 10 years already after med school. And then when I decided to start the USMLE step, I started from scratch. So USMLE step 1, 2, CK,
What was
OET.
that like as studying biochemistry after being a radiologist?
Oh, it's very hard in the beginning. The step 1 definitely is the worst, but it's doable. It's doable. That's
sure.
the thing. You have the resources, you have the materials, the books for that, and the QBanks.
And then, sorry, I didn't mean to cut you off.
No, just so one thing that comes along with that, especially for old graduates, that you have established weekly hours of clinical work. You need to adjust that regarding either reducing some hours so you can have some extra time to study. You need to adjust your personal time. There are some difficulties in the beginning, but then after you start, you can just go through all the exams. And then it comes the most important thing for radiology, the alternate pathway we just spoke about, Randerson. For joining a fellowship program, the scores during the USMLE 2CK or Step 3, they are not that important.
Yeah, I was going to say that precisely.
That's the trick.
Yeah. I mean, when you guys are applying for a fellowship, and this is not just for radiology, I know cardiologists who've come do a fellowship here, your CV, your connections, your experience are going to be more valuable than, your Step 2 score. Obviously, you want to pass. You don't want to have like a fail on Step 1. It doesn't look good, but even then, like there are other things that are way more important than that score.
Exactly. You said it all. I mean, connections, having good mentors to help you build a plan and to help you with recommendation letters. For radiologists, the scores are not important. You need to pass the exams. You need to have your ECFMG certification. You need to pass the Step 3. But you're going to be evaluated during your interview for your overall career. How are you going to handle the fact that you're going to come from outside and become a fellow again or an attending? So these aspects are more important.
Yeah. Interview true in that sense, right?
Yep.
Yeah. On that note, what was the transition like for you? After being a radiologist for so many years in Brazil, and you applied, you got this amazing job at UT Southwestern, and then you started to work. What was that transition like?
Interesting, yeah. So in the beginning, we feel am I gonna fit? I'm gonna adjust, and things gonna work. Step by step, day by day. It's different. People working in US is definitely different from working in Brazil, working in India, working in Europe. So you start getting the culture of it. On the other hand, US universities and hospitals have a very, very big infrastructure, especially when we speak about radiology. And then you get the hang of it. So over the time, you get settled on the professional side, and you start enjoying living in U.S. I think the American dream, as everyone says, it's rewarding.
Yeah, for sure. I fully agree with that. Atul, give us a sense of what your week is like just like your day to day. What time you get in the hospital, how many studies you read, what time you leave. What's day to day like?
Yeah. So my weekly routine is Monday to Friday, 8 to 5. Almost every day we have some meeting, case conference, or a internal meeting. I have 1 day per week of research and education, so 80-20, that's the ratio. And once in every 6 weeks, a weekend on call, so I cover Saturday and Sundays. We have the benefit as radiologists mainly all the calls we can work from home.
Nice.
And my routine daily is on the clinical side. I read all sort of exams, everything related to MSK radiology, meaning X-rays, CTs, MRIs, ultrasounds, and also procedures. And then just bringing back that question you had for me just now about the transition to USA, part of it was getting out of our zone. So after working so many years in the same settings, you come to a different country, you get out of your comfort zone. And then I learned a lot of new things here. Different type of studies, different type of diseases, different type of spectrum of diseases, better saying. And that's very interesting. I mean, you keep challenging yourself.
Yeah. It's a common theme for very successful people who sit in the seat here, because that's the whole topic of what we discuss here in MetaCast. It's the building of successful careers like the incredible one that Tu just described. But it's It's a common theme of people just, taking on challenges, of course. You came as a research fellow after being a radiologist, and you could have stayed, but you also went back because you wanted to build a great career in Brazil, and then you wanted to do the alternative pathway. So, I mean, people talk about the comfort zone, and of course, you're always challenging yourself and looking for these new endeavors.
Exactly. And the interesting part of it is that when we are all settled, and I think we are we are always looking for new challenge, like you said. And then when the ABR rule just came this year, that was allowing one to split in different institutions. For me, it was interesting because I wanted to do something different, and now I'm just transitioning to another institution where I'm going to be able to do what I did most during my career, which is sports imaging. So I'm happy to first-hand news here to bring this news that I'm joining practice in Miami.
Phenomenal practice in Miami.
It's the Baptist Health of South Florida and Florida International University, and they'll be part of the official medical providers for the biggest sports team in Miami. So going back to sports imaging, what I love most.
Fun fact, Atul was a radiologist in the Rio 2016 Olympics.
Exactly.
What was that like?
It was amazing experience. We covered the inside the medical village. It was built a radiology department, and we had X-rays, ultrasounds, and MRI on site. It was very busy. You cannot imagine. Not only doing studies and scanning the athletes, but also all delegations and everyone that was working there. So it was very busy setting, and getting in close proximity with the biggest athletes, pro athlete level, not only the athletes, but also the physicians, the medical team's physicians, the head physicians. It was very, very interesting experience, which I have a lot of great memories. I learned a lot, and it was unique.
Well, dude, this has been fantastic. Final question for you. When you're not, reading MSK studies and publishing great papers and teaching people how to do the alternative pathway, how do you like to spend your time, like your hobbies?
I think traveling. I love traveling. I love photography, drone photographies.
Wow.
Many days that I'm on my free time, I'm doing something related to MSK radiology, which I'm very passionate about. But I'm trying to enjoy life, have quality time during the weekend with my wife, family, and living the dream.
Nice. Well, congratulations on a beautiful, beautiful career. So, guys, this was MetaCast, the podcast of the Meta-Analysis Academy. Extremely honored to welcome Atul Taneja here to the stage. If you're Portuguese speaking, if you're from Brazil specifically, we're going to do an event in Brazil called the Medical Research and Career Conference, discussing entirely how you can transition your career to the United States. Whether you're a radiologist or other specialty, make sure to join, okay? We have final tickets available, so make sure to grab those before we run out. And also, don't forget to subscribe to the channel, and then also join the waitlist of the Meta-Analysis Academy if you want to learn how to publish these really impactful papers to build your CV. Atul, one last message for you as an inspiration for people who are listening to the story and they say, wow, that's an incredible career. Just an advice that you would give to our listeners.
I would say hard work pays off.
Yeah.
Don't get bad concepts and bad ideas get into your mind. Just stay focused, do your best, do what you love, and things gonna happen.
Yeah, beautiful. And one step at a time, but also focus on the midterm, long-term of the career. Like you've made some very strategic decisions early on.
Definitely.
That paid off like years later in your career.
You need to think years ahead.
Yeah.
You need to plan years ahead, and start the sooner the better.
Beautiful. Congratulations. Thank you for joining.
Thank you very much.
MetaCast.
Thank you for having me. It was
so this was MetaCast, podcast of the Meta-Analysis Academy.